said, I do come to my role with I came to my role with zero environmental sustainability expertise. I came from the media and communications team within South Metro Health Service, and I'm a journalist by trade. So I suppose what I bring to the sustainability area is the ability to see the problem, distill the problem, and hopefully bring people together to find the solutions to those problems and then enact them. The project I want to present to you today is called Think Before You Bluey, and the reason this caught my attention when I first started in environmental sustainability is one of our product liaison officers told me that we use 2 million blueys every year in WA Health, and I was horrified by that number. For those who don't know what a bluey is, I'm looking out at my audience, and I'm presuming online that there's lots of clinical people. We call them blueys in WA. Maybe I'm presuming they're internationally known as a bluey. That thin plastic sheet that has the slightly absorbent layer on top of it. They're everywhere, and they're very widely used. So that's a picture of a bluey. So just in our health service, being South Metropolitan Health Service, we use more than 400,000 blueys every year. They're used everywhere. They're used like tissues, I think, in some areas. There's the volume at which we go through them. They're often overused and used for the wrong reasons and in the wrong situations. And what most of our staff weren't aware of, or maybe they were aware of and didn't understand the consequences, they can't be recycled, and they all go to landfill where they break down and contribute to carbon emissions. And as we're finding out more and more about microplastics and nanoplastics, they're also making a contribution to that. Focusing on blueys gave us an opportunity to look at waste reduction rather than waste disposal. And a lot of time, especially in a hospital environment, we get caught up in the waste disposal end, our recycling end, where we need to be working. I think the previous speaker talked about the waste coming into the hospital, and how do we reduce the amount of stuff we're using, so then in turn we can reduce the amount of stuff we have to get rid of. And it was always also because their bluey has such a high profile, and everybody uses it. It's an item that people can relate to, and it's something that everybody would see and understand. So it's a way to get our staff thinking about waste, and also to think about other opportunities that would offer up in terms of materials that they used and consumables they used every day, and to get staff to understand that every consumable, everything they use, has a consequence, and quite often, apart from the cost of getting rid of the waste, it has an environmental consequence as well. So to kick off the campaign, we pulled together a committee. So we had nurses, of course, because we know nurses through Jen's presentation are front and centre in everything that we do. So we made sure that we had a good representation of clinical staff, and we had Archie from our theatres group had already done a lot of work within theatres in reducing blueys, and theatres at Fiona Stanley Fremantle Group, prior to us starting Think Before You Bluey across the whole organisation, had reduced their bluey use by 10,000 a year just through communication and education. So we wanted to make sure that we took advantage of that and were able to then drive the messages they'd been using throughout the organisation. So we established a committee. So we were working with people that were experienced in the front line. We undertook a staff survey so we could fully understand. We kind of knew when people were using them and why they were using them, but we needed to fully understand that. And we also knew that our staff would have suggestions on how we might reduce bluey use. So we were interested in finding out that as well. And then we used all of those staff survey results to help tailor the messaging so that we knew that when we were coming up with the messages, they would resonate with our staff and that they would understand them. So you can see here when we asked them when they typically used a bluey, the top ones are, addressing changes in wound care, and inserting catheters and things. So that seems like reasonable use to me. But mopping up spills and fluids and things like covering for a pillow or a headrest or a chair protector. some of these things stood out as ways that we could be using other things instead of a bluey, linen and things that were reusable. So from this information, there was obviously more questions than just this one. We were able then to target the messaging. Some of the survey feedback was great. A lot of support for reducing bluey use. Some of them saying just get rid of them altogether. Others saying thank goodness we have them. And my favourite at the bottom is, if you take our blueys, we riot. So we had to make sure that in the messaging, it wasn't about taking anything away from anyone that they found clinically useful and help them to do their job in a safe and efficient manner. So that last comment was particularly my favourite. But for the most part, staff understood the problem and were supportive of what we wanted to do. So from this, we settled on some key messages being, do I really need a bluey for this task? Do I need to use as many? Is there something else I can use instead? So everything we use in health comes in packaging of some sort that offers opportunities to use that. You know, when you're in, you want to protect something, you can put the packaging down instead of pulling out a whole new bluey. The packaging is going to go in the bin anyway. So let's have a look at that. Do I need to use as many? Some people were using too many blueys for a task where one item, by choosing another single item, would have done the job. So something that was more absorbent than a bluey, and you use one of those things rather than 6, 8 or 10 blueys for the same job. There's technical terms for them like Kylie's and things like that all the nurses and doctors in the rooms would understand. And lots of these are launderable products as well and reusable. And the key one was, do I really need a bluey for this task? And through the campaign, it was about that moment to stop and think, because we get into our work and we're into our rhythm and we're doing things like we've already done them. We wanted to interrupt that behaviour and get people just to take that one moment that it would take to think about whether they actually needed it or not. And you can see we had really engaging posters and things like that made through our comms team. So it was important to have that support. We also used the waste hierarchy. So for staff to refuse to use them, reduce the number that they use, and to reuse clean packaging and other items instead, or swap to another product. So we had some sort of dual messaging going on, but the refuse, reduce, reuse and swap was also key to it. So initially we started with a goal of a 10% reduction over the 12 months of the campaign. So we kicked off in this room that I'm in for Plastic Free July, and we were lucky enough to have the founder of Plastic Free July, Rebecca Prince-Ruiz, who is a Fremantle local, so she's from Perth in Western Australia. She kindly came along and helped us launch this campaign. So for her, it's about seeing what she launched, I think 10 or 11 years ago, now finding its way into places that I'm sure she never even imagined that even her campaign would find its way. And we also had 2 presenters from the Minderoo Foundation, which is another West Australian research body, and they're doing an enormous amount of work on micro and macro microplastics in health. And where it's turning up, where microplastics are turning up in the human body and the harm that that's doing. So it was able to demonstrate to our staff that by reducing their bluey use, they're not making the contribution to creating the patients of the future, and trying to make that link. We used our purchasing data as a way to track how many were being ordered and obviously being used, where people were replenishing them through their storerooms, etc. So that was the key way that we were going to evaluate and track what we were doing. And because I have my comms background, I was able to use that comprehensively. We created an internet page, so all the resources that were required for the campaign were there for anybody to use. We had a presentation that was an educational presentation. We had all of the posters that people could print locally. Jen mentioned huddles, so the daily huddles on every ward to talk about important issues for all of our staff. We got these, Jen actually wrote a fantastic bluey huddle script for the nurse unit managers to talk to their staff about the campaign and the kinds of things they could do in their wards to help reduce bluey use. Then we fed back the successes to staff. So where we knew that staff were doing good work and where they were reducing their bluey use, we told those stories in the newsletters and in articles, and to make sure that they could see that the changes that they were making at their ward and area level were actually having an impact. We also did that through the data, and we fed this data back on a quarterly basis. So you can see, I'm not a finance or a numbers person. I put this together myself. So a round of applause for me for even managing that, I think. But you can see we started out with a real blast, and in the first 2 quarters, we significantly reduced by 26%, then 25%. And it has slowed down, which is to be expected. But I think the significant thing is what we've achieved over the 12 months, and that is way beyond what we ever imagined in the beginning. And we have reduced our bluey use overall by 21% in that 12 months, which is equivalent to more than 82,000 fewer blueys going to landfill. And that was obviously the aim. It was never about cost saving, but as we know, lots of sustainability measures have cost benefits. So we've saved almost $19,500 in buying blueys, but a further $500 in waste disposal. They don't weigh very much, so they don't have that much of an impact. But if we've got 1.9 tonnes less waste going through our waste stock, then that is a good thing. So a total of 20,000 in savings is not to be sniffed at, and hopefully that can go back into my pot of for sustainability projects. So what did we learn? We learned that ongoing education and that encouragement and that engagement is vital to maintain momentum, and feeding back to staff, telling them that they're doing a good job and showing them that they're making an impact. Clear messaging, simple instruction. As Jen has said, our staff don't have the time to fiddle about. As long as it's clear and they understand exactly what's expected of them, they will do it because they want to do the things that make a difference, and we certainly know that as well. Our staff have the ideas, and quite often they have the solutions. Ask them, they'll tell you. And that was, I think, one of the best things about this campaign was our staff and their involvement. And keep it simple, as I think we managed to do. So what's next? Think Before You Glove. We're going to take that theme. We launched our Think Before You Glove campaign in July. This is a bigger fish to fry, a lot more moving parts. Infection prevention have been wonderful and coming on board and supporting us in this clinical education. But it's an enormous problem in terms of waste, and they are wasted, overused. And when you look at those numbers that we use, I think it's 16 million non-sterile gloves in our health service every year. It's an extraordinary number, and I'm sure it's replicated in every health service out there. So if we can reduce it by 25% in the first year, we'll save $600,000, and I can then get some more staff. So thank you, everybody.
Thank you so much, Bridget. That's such a remarkable story. And even though it's something so small, it was so impactful, and $25,000 saved, that's almost a quarter of a third of an FTE that we could put into working in sustainability. The other aspect of it, it created a level of accountability. As an ex-ICU nurse, I found myself talking at the coffee shops and saying, what a marvelous work we've done here and with blueys. And you imagine what you did in the past with them. So it brings in a bit of personal accountability of your behavior in the past and forces you to look at your behavior in the future as well. So thank you for that guilt trip, Bridget. And it's really important to go there.